My name is Sutphen. I'm an orthopedic surgeon at the Illinois Bone and Joint Institute. I specialize in the field of adult reconstruction and hip and knee replacement. As a hip and knee surgeon, I specialize in minimally invasive hip and knee replacements, anterior hip replacements, posterior hip replacements, and partial knee replacements. I also specialize in revision hip and knee replacement and knee arthroscopy. I am certified in using technologies including robotics as well as computer-assisted navigation to perform hip and knee replacement surgery. One of the things I do during surgery is use minimally invasive techniques as well as enabling technologies including robotics and computer-assisted navigation. Using these technologies allows me to create a plan prior to surgery to execute at the time of surgery. This not only improves accuracy but allows customization for each and every patient. Total hip and knee replacements are by far one of the most successful operations that we do in medicine. Patients truly enjoy the pain relief and the opportunity to take part in the activities that they love. They get back to the person that they want to be. When I see you in the office, I take a truly personalized approach. This starts with a detailed history and physical. I discuss your radiographic findings, and I get a feel for each individual patient's expectations, getting back to the things they love to do, whether that be through non-surgical or surgical options. I always start with a conservative treatment approach and only proceed with surgery when non-surgical methods have truly been exhausted. I love what I do, and I take what I do very seriously. I make sure to get to know all my patients in order to learn how their problem is affecting their quality of life and make a customized plan for each and every patient. I recognize that every patient is different. Whether you're a high-level athlete, a retiree that loves to travel, or someone that has dealt with a long-term functional disability and wants to regain function and mobility, the treatment recommendations may differ, and shared decision-making is key. I believe that a strong physician and patient relationship is key to a positive outcome. I take a true team approach. I like to be involved with the patient every step of the way. I always tell my patients, once you're my patient, you're part of my family. We are in it for the long haul. I will always be there for you. I completed my residency in Columbus, Ohio, and went on to do a hip and knee replacement fellowship in New York City at the Hospital for Special Surgery, which is the #1 ranked institution for orthopedic surgery in the country. This provided me with the opportunity to learn the most modern techniques and surgical skills to provide the highest quality care for my patients. One of the greatest strengths of IBJI is that in every specialty you are working with the doctors who are truly the best at what they do. They are leaders in their fields of orthopedic surgery. The Illinois Bone and Joint Institute is a truly special place. Physicians, staff, they really work towards one goal, that being to provide the highest quality of care for each and every patient. My favorite part of really what I do is getting to see patients return to their quality of life that they've wanted but have been hindered due to an orthopedic issue, whether that be through conservative treatment or surgical intervention. The opportunity to have a patient go from a disabling condition to essentially near normal function after a joint replacement is truly unremarkable, and I am really honored to be able to provide that care for my patients.